Welcome back to the Back Pain Solutions podcast with me, Ben James. I'm doing a solo show today, so I'm on my own, just discussing a few key points following some conversations recently with some patients that I've seen. So often patients will come in to the clinic. They'll come in with pain, and they're wanting quick solutions. Okay, they're wanting quick solutions. They're wanting to know the top three things. What can I do to look after my back? And first of all, my go-to now for them is firstly, look, slow down and educate yourself with potentially my support, Jacob's support, other practitioners who are going to educate them on their back health, so they better understand their back anatomy and why they're getting pain. And this, I think, is key. And so I invite all listeners today to head on over to the SmartStrong website, www.smartstrong.co.uk. Download our ebook. So I ask you all to do that now and to have a good look and a good read, because it will provide you with a lot of really useful information to help you better understand your back. That's the first thing, okay? Because too often patients are looking for quick solutions, or they're coming in and one of the first things that they're doing is they're resting. So we'll hear stories quite often from patients saying, yeah, I've had a back issue before. It goes back years, don't really know where it started. I've seen various people over the years, and it goes now and again. And okay, what have you done about it this time? How long's it been? Well, it's been about a week. So I've had a bit of time off work, and I've just rested. Okay, why? Well, I'm in pain, so it just felt like the best thing to do. We know now, a lot of people know now, that resting for back health, there's no evidence to support that. Bed rest is not a good thing. So why are we resting when we immediately get pain? I get it in terms of there's fear, there's concerns you're going to make it worse, so let's rest. But how many people listening to this podcast today have had episodic back pain? They've got a chronic history of back pain. Every now and again the back goes, as it were, so they get an acute inflammation, a really severe bout of pain, and the first thing you do is rest. Okay, let's not do that. Let's change that mindset immediately. Whether you're resting because of acute pain on a background of chronic pain, or whether, quite frankly, you're resting every day because you're just not doing enough exercise, we need to change that approach, okay? If you're suffering acute pain right now, there are always things you can do, walking being a good example, within your pain limits, that will help your recovery. There are always exercises that you can do that will be safe and will help your recovery and help to wind down that acute pain. Over the long term, we need to be less sedentary. We need to recognize that repetitive work, deconditioning, quite frankly, in some instances, dare I say it, laziness, are leading to this deconditioning of our musculoskeletal health, including our back health, that is essentially resulting in back issues. So rest, whether over the long term without doing regular exercise, or in the short term because of acute pain because you're bed resting, is the first thing I would say, mistake number one. So when patients come in and say, what are the mistakes I'm making? What are the key things I can do? The mistake or the key thing you can do is not resting, not bed resting. Let's stop that. We've got to keep active. We've got to keep moving. Now, I understand that some people can be suffering significant pain at certain times, and it's painful to move. So we need to then better understand, we don't want to chase the pain relief necessarily. We want to wind down pain, but don't just focus on pain relief. Right, okay, bed rest, medication, let the pain settle, and I'm back and I'm okay. No, let's understand our back and why we have the issue. Why do you have back pain? Because for the most part, you're not just unlucky. This is a very, 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 very common issue. Okay, so you're not just unlucky. If you've bent and picked a plant pot up or bent down and your back's gone, as it were, as some people will describe, that is likely the straw that broke the camel's back. So again, you haven't been unlucky. We've just been deconditioning or doing the wrong exercises and the wrong things day on day, week on week, month on month, year on year that leads to back issues. So again, it's back to getting that education about why you have an issue, not just chasing pain relief. So don't just look to take medication, get out of pain, and then say, do you know what, I'm okay, I'll go again. Because we end up in this repetitive cycle of kind of deconditioning, and subconsciously we move differently because we've had pain. Does that lead to mechanical changes that lead us to be off balance, some muscles stronger than others? We will often see this. I see this every day in clinic when I'll see patients trying to execute an exercise, and for example, the bird dog, great exercise for back health to train core stability. So we're on our hands and knees, we're really locking those shoulders in, we're trying to keep the pelvis stable, and we're extending a leg first of all. As we progress through, we can extend the opposite arm as well. But even patients that are just trying to keep the body still and extend the leg, you'll often see on the one side, not too bad, on the other side, they'll really shift their body weight over. They don't have that symmetrical kind of conditioning to support core stability. And could that be a result of amnesia of muscles? So we get an injury, we get this switch off of muscles. Over time, we move differently. And so we develop this asymmetry that just continues to lend itself to repetitive back issues. And this is what we really want to avoid. If we can really get on top of an issue well in the first place, there's no reason why you should suffer long term, but it does require work, and it requires an understanding of back health. So we don't want to rest, definitely not in the short term, certainly not over the long term. Mistake number one. Mistake number two is just chasing pain relief. So we don't want to just be, okay, I'll get out of pain and I'm okay again, because what's got you into pain in the first place? Some issue with some tissue and some inflammation as a result has led to the pain. So just taking away that pain isn't solving the root cause, which is often repetitively bad movements done day on day on day on day on day. Okay, so that's number three. It's understanding what are the daily things: poor posture, repetitively poor posture, repetitively bad movements that repetitively load the back in a way that deconditions that passive tissue, whether that's discs, ligaments, tendons, or otherwise. We start to decondition those structures that over time suddenly leads to the pain starting or that acute event. Okay, so we've got to better understand what we're doing on a daily basis. As I'm sat in this chair now, my pelvis is in neutral. So if you imagine your pelvis as a bucket of water, tilt forward, tilt backwards, water's pouring out the front, pouring out the back, find that midpoint between the two. Now I'm in a resting neutral position for my back. A little bit of a brace through the core as I'm sat here now. And also when I'm sat here for long periods, locking those shoulders down. So my chest and upper back is activated. So that really contributes to that kind of core stiffness that we really want to develop. So when I'm sat, I'm in a good neutral position for my back. I'm also not going to sit here for long periods of time without getting up, moving around. If I had long hours of work, every 20, 30 minutes, get up, move around, walk around, sit back down. It doesn't have to be long, but I'm breaking the repetition. And if you're an office worker and you can take that call standing up or the sit to stand desk, whatever it requires to vary the posture, variation is key. There's no perfect posture to sit for hours and hours and hours on end in a day. It has to be variation and trying to get regular breaks for walking. And that's only going to be a good thing for your mental health as well, and surely your productivity. So this isn't all just about back pain and managing back health. Let's look at things from the point of view of wellness as well. And so, spending long hours at a desk in an office, unnatural light, etc., 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 is going to have other health implications metabolically and otherwise, not just musculoskeletal health. So we've got to look to kind of daily spine hygiene as a key thing that everybody could do on a daily basis, something that just better supports their back health before they have an issue. Now, unfortunately, the majority of patients that are listening to this podcast, watching the podcast, are coming because of pain. And so over time, we really hope to get enough information out there that people are coming to us before they've got an issue as a preventative approach, because that really is how we need to tackle back health, as well as many other aspects of health. Let's face it, whether that's obesity, type 2 diabetes, even Alzheimer's and some of these neurodegenerative diseases. Now, we are seeing they are very much environmental lifestyle driven, and we can do a lot of things to prevent it, but we've got to be motivated and in that mindset. So you've got to be motivated to look after your back health, whether you've got an issue or not. We should be, and if you've got an issue, you have to be. You have to put in the hours and the work to get better again. But it is entirely possible. So don't be disillusioned, but just be mindful of these key things. So the key things for me: rest, long-term rest, essentially being too sedentary, is a key factor. Chasing pain relief is a key factor, mistake, if you like. And then repetitively poor daily spine hygiene is mistake number 3. Now, if we get all those things right and then start to add in good exercise rehabilitation in the form of core endurance, core stiffness, better movement when we're doing these simple activities of daily living, then there is absolutely no reason why everybody listening, despite your history, can get out of pain. I have a patient that I'm seeing at the moment, had 3 spinal surgeries, seen multiple osteopaths, chiropractors, physios over the years, and now has got to a position where she's in a lot of pain, and everybody she's been to see says, I don't want to touch your lower back. Well, I've been treating her, exercise advice, and doing a lot of soft tissue work through the lower back. The difference is staggering. So some hands-on therapy can help, but she's doing the active work, and that's helping to wind down pain, helping to desensitize, and it's also given her the belief that she can get better. And she is, but it is taking work. But she's not just chasing pain relief, she's not just resting, and she's really being mindful and committing to that change in terms of daily spine hygiene. So the conclusion here today is believe that you can get better. Avoid the 3 key mistakes that I've discussed today, which are, again, rest, long-term rest for sure, short-term bed rest when you have an issue, not helpful. Chasing pain relief, not helpful. Understand the issue, and you can better then wind down the pain and solve the issue over the long term. And that can take a little while, and pain can persist for months. But what we're looking for is that gradual reduction in pain. But if you understand your back health, if you can better understand what's happening, then it gives you that more clarity, which I think is really, really relevant and important. And the 3rd mistake is the simple things every day in terms of daily spine hygiene can make a fundamental difference to your back health. So be mindful of those 3 things particularly, and then long term we can add the relevant exercise and rehabilitation plan to build that core endurance. That's what we do at Smart Strong. We take a very much one-to-one approach. So we have relevant different courses. Some people are interested in a fairly generic course for their overall back health. Maybe have a little bit of a niggle here and there. They like to train, they want to prevent. Great, we can help with that. A lot of patients that are going to come to us with the chronic repetitive issues, we need a one-to-one program. And that involves specific intake. It involves a bespoke approach, but we do that really, really well. So if you are interested in it, if you've got any concerns, if you've been suffering for years, it's just not getting better, reach out to us, info@smartstrong.co.uk. or get on the website, as I say, www.smartstrong.co.uk. Download the ebook, read the ebook, send over any questions you've got. But there is a lot of information in there that will help a lot of people without you necessarily needing to seek that guidance. And that's the aim, to get that information to the masses to really make a difference with back health, because we're doing it, and we know we can help so many more people. But don't suffer in silence. We're here to help. We're happy to help, and we're very much motivated to help. So thank you as always for listening and watching. Again, that email is info@smartstrong.co.uk. We check into that email daily. Happy to answer any questions that you have, but reach out to us, myself or Jacob, and we'd be happy to help. And as always, we ask, if you can, give us a rating in terms of podcast reviews. We know that a lot of people listen to podcasts and they're not doing that. Really just help get the message out. So if you can take the time to do that, really appreciate it. Thanks again for listening. We'll be back again with another episode soon.